I don't know how to get rid of this.
Welcome to the Welcome to the Nairobi Health Show, everybody. I'm here with Dr. Michael E. Platt, who is just taking care of audio-visual issues before
All right.
we jump in wholeheartedly. But Michael, can I call you Michael, or
Oh,
do you prefer?
absolutely. Yes.
Okay, fantastic. We don't stand on ceremony then.
No, not
That's
at
great.
all.
Well, welcome to the show.
Thank you.
The title of this show is a very interesting one, and one that I haven't actually covered before. It's called The Clinical Consequences of Excess Adrenaline. And Dr. Platt has a lot to say on this topic. It's been his life's work for a little bit. And Dr. Platt, I'm going to read your bio real fast so people get a feel for who you are, and then we'll jump right in.
Okay.
Dr. Yeah, thank you. Dr. Michael E. Platt is a world-renowned pioneer in effective dose progesterone, adrenaline dominance, and bioidentical hormones. He has 3 award-winning books, The Miracle of Bioidentical Hormones, Adrenaline Dominance, A Revolutionary Approach to Wellness, and The Platt Protocol for Hormone Balancing have received a total of 11 literary awards. For over 39 years, Dr. Platt has addressed conditions that medical science has defined as impossible to cure, which is very interesting. Conditions like depression, bipolar disorder, fibromyalgia, ADHD, autism, RLS, weight gain, and others. And so this is a very basic topic. And I understand from your work that you have found that when we address certain conditions or imbalances in the body, that it can have outstanding positive benefits.
Absolutely. Yes.
And why adrenaline? And maybe we start with your story as it relates to when did you discover that adrenaline was such an important topic in health?
Well, I initially started with just with bioidentical hormones. Um, the importance of hormones is that they control every system in the body. And what's interesting is that doctors don't really get much in the way of training when it comes to hormones. But anyway, I got very interested in hormones, and I and my practice actually was just about dealing with hormones. And when I saw patients, I had the luxury of being able to spend about 2 hours with every patient. And, you sit down and you talk to them, and that's how you really find out, you know, 90% of a diagnosis is actually sitting down talking to a patient. And uh, over time, what I started realizing is that a lot of these people had the same symptoms. And, and through intuition, logic, this, that, whatever, I realized that they had problems related to excess adrenaline. And and so that's what my research and whatever dealt with, was trying to find out why is it that people put out a lot of adrenaline. You know, it. They call it the fight or flight hormone. And there's no question when people are in danger, the body pours out adrenaline. But that's a very rare reason why the body puts out adrenaline. What I was able to determine is that the primary function of adrenaline is just to raise sugar levels for the brain. And most people do not realize that the brain uses more sugar than any other tissue in the body. So anytime the body detects a drop in glucose, sugar levels in the brain, it just simply puts out adrenaline. So what that means is that if I mentioned that doctors don't get training in hormones, but doctors are not trained to treat the cause of illness either. They're trained to give out band-aids. And, that's why very few conditions or diseases are ever cured, because they're not treating the cause. But but what's nice about problems related to adrenaline is that here you can treat the cause and actually eliminate a lot of these conditions. And we'll talk about those.
One of the
Um,
things we hear a lot about in our modern society is cortisol. A lot of health coaches and nutritionists talk about cortisol, high cortisol levels, which is also related to fight and flight. But you're talking about adrenaline. Can you talk to us about the difference there between adrenaline and cortisol?
I absolutely. The adrenaline is a very powerful hormone. And when the body releases adrenaline, it actually creates stress to the body. And the body actually uses cortisol to deal with stress. So anytime people have an elevated cortisol, it's because they also have elevated adrenaline. So and what's interesting is that adrenaline peaks at 2:30 in the morning. In fact, a lot of people get up that time to urinate because adrenaline gives people that urge to urinate. On television, they call it an overactive bladder. And this is why a
Hmm.
lot of women have to run to the bathroom because adrenaline urge to urinate. But
Hmm.
in any event, so adrenaline peaks at 2:30 in the morning. And the reason why 2:30 is because the brain runs out of fuel then. And so the body releases adrenaline, it creates stress, then the body puts out cortisol to deal with the stress from the adrenaline. Now, keep in mind that both adrenaline and cortisol raise glucose levels. And the whole thing about sugar, glucose, is that it doesn't matter whether you're eating glucose or if the body is producing it. If you don't burn it up, all that extra glucose goes right into your fat cells to be stored as fat. And I am absolutely 100% convinced that the number one cause of weight gain is actually excess adrenaline. Nobody
Hmm.
talks about that. Um, the so by reducing adrenaline, you also reduce cortisol. Now, while we're on this subject, your listeners may have heard of a condition called adrenal fatigue.
I'm pretty
and
sure.
adre-
I'm pretty sure I spent years with adrenal fatigue,
well,
self-diagnosed. But
well, let me tell you something. Adrenal fatigue is a non-existent condition.
okay,
It's a naturopath diagnosis, and the reason why naturopaths diagnose it, they do saliva tests. And the thing about adrenaline is a survival hormone, and so it cuts off blood supply to areas of the body that are not needed for survival. And that's where cold hands and cold feet come from. People think it's a low thyroid, but that's actually adrenaline. It cuts off
okay,
blood supply to the intestines because they're not needed for survival. That's where IBS comes from, irritable bowel syndrome. But it also cuts off blood supply to the salivary glands because they're not needed for survival. So the hormones do not get into the saliva. So when they do a saliva test and there's a low cortisol level in the saliva, they diagnose adrenal fatigue and they treat it by giving people cortisol or trying to bring up cortisol levels. And the thing about when people have a lot of adrenaline, they already have a lot of cortisol. And cortisol is not a happy hormone. Not only does it create weight gain, but it causes damage to the immune system and it causes osteoporosis. So, so adrenal fatigue is really adrenaline dominance. I just want to let you know that.
interesting. So it's kind of a misnomer. So those symptoms that we feel, athletes who train too much, or what we call overtraining, a lot of those things, you feel like the underlying condition that they really have is probably an adrenal condition.
Well, professional athletes have a lot of adrenaline to begin with. People that go into the military or law enforcement have a lot of, it's a fight or flight hormone. They have a lot of adrenaline. Um, but the adrenaline is both a hormone as well as a neurotransmitter. And as a neurotransmitter, adrenaline is responsible for giving people intelligence. And it also enhances what's called creativity. The most intelligent, successful, creative people in the world have a lot of adrenaline. And they,
Okay.
and they can thank the adrenaline for the benefits. But again, having too much adrenaline will affect somebody's health. So, and again, we'll talk about that.
And you feel
Um,
like this is quite a common condition. Do you have any numbers for us or guesses on
well,
the size of the problem?
we're talking about people in the millions, and I tell you why. Um, I don't know the exact incidence of ADHD. I'm sure it's much higher than what people realize, but we're talking about millions of children with ADHD, and ADHD is all about adrenaline. And we'll talk about that. There are probably about 8 million people in this country with fibromyalgia, and that is caused by ADHD, by excess adrenaline. So, I'm, so, look at all the millions of people that have anxiety. Anxiety is only caused by excess adrenaline. So I'm just saying what we're talking about affects millions of people.
Okay.
Um, I mean, a lot.
And you've been successfully treating people along the lines of this methodology that you're telling us right now for a long time. I mean, you have a lot of clinical experience in this.
I have a lot, yes.
Tell
Because
us
that's what,
maybe, yeah, and
yeah.
obviously I don't want to go into someone private details, but generally speaking, if you could give us just some made up kind of case studies or the typical kind of person that comes to you and maybe what they're complaining about and how you diagnose and how you treat. How does that
Well,
process work?
okay, now somebody who does have excess adrenaline, let me give you some classic symptoms.
Okay.
They'll have trouble sleeping. The number one reason why people have trouble sleeping is adrenaline. Some people have trouble falling asleep. Some people have trouble staying asleep. Some people toss and turn. Some people grind their teeth at night or clench their jaw. Some people get up at night to urinate. Um, and they have something called restless leg syndrome, which is also caused only by adrenaline. So, and then people who have a lot of adrenaline, not only will they have sleeping issues, it's an anger hormone. That's where road rage comes from, is adrenaline. But
Mm.
people that have a lot of adrenaline, they're quick to anger. They're short fused. And people with a lot of adrenaline may have cold hands and cold feet. They very often carry a lot of tension in the back of the neck, and that can cause tinnitus, by the way, and it can cause headaches.
Hmm.
There's everybody's heard of migraine headaches, but in my experience, just about every patient I've ever seen who thought they had a migraine headache actually had another type of headache called occipital neuritis, which most people have not heard of, but it comes from the occipital nerve sheath at the base of the skull. And so people with severe headaches, if they put their thumb and press in at the base of the skull, they'll find a very tender spot. That's the occipital nerve sheath. And when people have a lot of adrenaline and the muscles tense up in the back of the neck, it squeezes that nerve sheath. It causes excruciating headaches. They very often shoot right into the back of the eye. But these headaches are easy to get rid of. Just applying some progesterone cream on the back of the neck will get rid of these headaches and very often get rid of the tinnitus.
I've had
The
tinnitus for years. I hardly ever talk about it, but I have it right now. Like right now, there is a ringing in my ears. I typically am used to it, and so, but if I just pay attention, there it is. And sometimes it's worse than others, but I've had it for a very long time.
Well, let me, excess adrenaline is not the only cause of tinnitus, but it's
Hmm.
a very common cause of it.
Okay.
And I would say to you, if your problem is related to adrenaline, we can get rid of it. Um, the so People with a lot of adrenaline, they can experience anxiety. A lot of people wake up with low back pain due to adrenaline.
Hmm.
It A lot of symptoms, now, the other thing is that I mentioned that uh, excess adrenaline is the cause of ADHD. Um, ADHD, a lot of people consider it a learning disorder, but ADHD is not a learning disorder. It's an interest disorder. Um, the A child with ADHD has no trouble focusing on things they're interested in, but if they're not interested, they will not focus. But what's interesting is that you can actually get rid of ADHD in 24 hours just by lowering adrenaline. Um,
Are you the only one saying? I mean, these you're making claims here,
I
based
realize that.
yeah, based on
My
your experience, and I'm
Well,
not criticizing, but are you a lone wolf here, or is there a community of other practitioners finding the
um,
same thing, or where are you at in terms of other practitioners getting on board with the things that you're saying? Are you the first and only, or are others coming around to your way of thinking too?
well, others have come around to my way of thinking, but it's tough to change the thinking of doctors. It's tough. It really is. I've written a book called Adrenaline Dominance, and just to give you an idea, it's the only book ever written that talks about the clinical consequences of too much adrenaline. It is completely off the
Interesting.
radar. You know, you would think that functional medicine doctors would be really interested in problems related to excess adrenaline because they deal with the cause of illness. But I've gotten in touch with a number of functional medicine schools. They had no interest. And I'm not surprised by that because it's hard to change the thinking of doctors. They can say it can't be that simple. And the sad thing is it is that simple. You take a baby with colic, and actually the first indication of a lot of adrenaline are babies that do a lot of kicking in the womb. That's adrenaline. And these are the babies that are the ones that have colic when they're born, which is also caused by adrenaline. And if you were to take a 5% progesterone cream and rub it on the baby's belly, in about 3 minutes, the colic is gone. Otherwise, you're up all night with the baby crying. Um, the terrible twos, again, caused by excess adrenaline. You may have heard of bedwetting in children. You only see that in creative type children. And the reason for that is that creative people actually have the most adrenaline. Um, and so if you have a child who's a bedwetter, I can tell you unequivocally he's a creative type child.
Interesting.
And the and then the next will be ADHD, and ADHD again is an easy condition to do better. And they have children on drugs like Ritalin, Strattera, Adderall, which are stimulants that increase adrenaline levels. And what
Hmm.
it does, it numbs the brain. But these drugs have a side effect called sudden death, and that's an acceptable side effect for with regard to the standard of care of the way we treat people
Hmm.
and children, by the way.
What is causing this, in your opinion? Why do we have so many people, even babies out of the womb, who have an imbalance of adrenaline?
Well, it's 100% genetic. In other words, if a person has increased adrenaline, one of both parents had increased adrenaline. It's always genetic. Um, the And so, all doctors have ADHD, by the way. I had classic ADHD as a child. I used to get up and walk out of class. I couldn't focus at all. It wasn't until I got into medical school that I started studying. And the reason for that, I was interested in medicine, but there was nothing in high school or college I had any interest in. Um,
Hmm.
Luckily, adrenaline also provides intelligence. So you're able to, you get by with studying just the night before an exam and you pass it. But um, but so ADHD is very common. Like I say, there are a lot of intelligent people in this country, and they can all, thank excess adrenaline. Um, the so um, there are conditions like you may have heard of women that vomit throughout their entire pregnancy. Again, that's only caused by excess adrenaline. There's a condition called cyclical vomiting syndrome, which is also caused by excess adrenaline. But again, doctors are not aware of this unless they read my book. But
How did you determine this? Is there studies, or is it all just from personal clinical experience, or where did you find the data in this where it's so under the radar? You're the only one who's written the book. And so
there is no data except in my book. If you read my books, you'll notice that there are no references in my books to other articles or books. And the reason for that is that everything I have learned from my patients. Now, they call that observational based medicine.
Mhm.
What doctors are tuned into is what they call evidence based medicine. And evidence
Yeah.
based medicine is when you do double blind studies. They're only performed by drug companies who have the hundreds of millions of dollars that can do these tests. And I don't believe it. I don't believe evidence based medicine. I believe in observing and seeing how things happen. That's real medicine. That's the way medicine evolved over the thousands of years. But in the last 50 years, now we do evidence based medicine and we've stagnated. Nothing has changed. I don't know if people are aware of this. The United States is on the bottom of the list of healthcare of all civilized countries. We have the highest incidence of strokes and cancer and heart disease and obesity and diabetes. I mean, you name it, we're number one. Even with infant mortality, we're number one. So we don't have a good healthcare system, and I attribute that a lot. I hate to say it, to the drug companies, because they thrive on disease and illness. They do not thrive on wellness. The last thing they want is a healthy population, and they're in charge. They're in charge of what doctors learn in medical school. They're in charge of the FDA and the medical boards. I mean, you name it, they're in charge. So
I don't
I'm
disagree. And for those listening, I mean, those of you listening, I mean, I've done over 200 episodes of this podcast. Probably most of my guests have a PhD in one thing or another. We have a lot of very educated people on the podcast, and a lot of very talented people. And the word evidence-based in my world of dietary supplements, it's a great term because unfortunately there are shysters in the dietary supplement industry who oversell their products, and there is no evidence. Now, evidence-based though can be a really great sounding but empty promise, because I believe 40% of all studies are thrown in the trash and not published, first of all. So out of 100 studies, as you said, most of them are funded by drug companies who want a certain outcome. If they don't get that outcome, they throw it out. They're never going to publish the study that isn't supportive of what they do. And then we have this massive problem of replication. Many of the studies that have been done in the past that we have based decisions on are recreated years or decades later and do not work again and do not replicate the second time. So you have the replication problem. So I don't know that I'm 100% on board with the way you framed it on evidence-based, but I definitely see the problems with it, is what I'm saying. And so I do think that the underlying thought that you're sharing of the drug companies kind of ruling the roost in our healthcare system, I think is true. And I think that leads to all kinds of problems. And the follow the money is a very simple thing to do, at least in the American healthcare system. Who makes the money? How do they make the money? No one makes much money when people buy apples, oranges, and green leafy vegetables at the grocery store. Not when we eat healthy, right? There's not a lot of money to be made, right? So we hear very little about just the very basics of nutrition. And then we go and watch television and we see very expensive advertisements for drugs. And then they get to the almost laughable end where the professional voiceover reads the list of ailments that can the side effects that can come from taking these poisons, really. And so your solution, and you've mentioned it a few times already, is your main treatment progesterone? Is that the number one go-to?
Well, what's nice about, and again, it's a 5% progesterone, because that means that each pump is 50 milligrams. And 50 milligrams is the exact strength you need to block adrenaline. So that's the only, if you want medication or whatever that's needed. But the primary approach to lowering adrenaline is nutritional.
Okay.
And, the brain uses two different fuels in order to function. One is glucose. And actually, the best source of glucose comes from vegetables. It's not that they're a tremendously high source of glucose, but the type of glucose that comes from vegetables does not stimulate a lot of insulin. Candy and soda, great sources of glucose, but they're highly glycemic. They produce a lot of insulin, which lowers sugar levels, defeats the purpose. Now, the other fuel, which is even more important than glucose, are ketones. And people have heard of a ketogenic diet. I'm not pushing that because it's a hard diet to accomplish, but you can get ketones directly from coconut oil or MCT oil. And this is basically all you need to lower adrenaline.
And can I just pause and interject something right there on that point? What do you think of exogenous ketones?
Well, coconut oil and MCT oil, I guess, would be considered exogenous ketone, or I may be missing something.
Well, it's just the difference between your body naturally producing ketones when you're in the state of ketosis.
Oh, okay. Yeah.
Your point
right.
Of it's hard to be in ketosis. It actually sucks. I've done it before. It's not a diet that I want to live, but I do intermittent fasting in hopes to have some time in ketosis on a regular basis, get my body used to using fat as fuel. And so, but the difference between your body producing ketones from being in the state of ketosis is different than not being in ketosis, but ingesting something like you just said. And I just wondered if you had any experience with these actual supplements where you mix up a drink with ketones and drink the drink.
I recommend that all the time. I mean that.
Okay.
Um, Now, keep in, the problem with intermittent fasting is that you're going, the brain uses up fuel sometimes every 3 to 4 hours, the brain uses up fuel. So if you're doing intermittent fasting, you're going long lengths of time without eating, which means that the brain is without fuel. So you'll be a lot of times you'll be living on adrenaline. Um, because
It's interesting. Yeah, I mean, the rage is to go down to as little as 8-hour eating windows, even 4-hour eating windows. I just had Dr. Joseph Antoon on my show recently. Do you know Dr. Antoon?
no, I don't.
He's at UCLA, where they've got a lot of funding from the NIH on intermittent fasting. And he actually was making similar points to what you are right now. He was suggesting that it's perfectly natural for the body to go 12 hours without food from, say, sundown to sunup. So that's a very natural circadian rhythm, and the body is well aware and evolutionarily prepared and built to do a easy 12-hour. But he was also hesitant to go longer than that. So I thought that was quite interesting.
Well, remember, I'm not really a researcher in a laboratory. I deal with patients and talking to them and,
Yeah.
and whatever. So, you know, so he probably has a lot more to offer than I do. And, I go by logic and intuition. Um, but what I do know though is that the brain does run out of fuel right around 2:30 in the morning. Um, and so, I very often recommend that people eat something before they go to sleep. And people that do intermittent fasting do not do that. Um, but if they don't want to wake up, or, during the night, then they need fuel. Otherwise, the adrenaline will wake them up.
Yeah,
Gotta make,
and
gotta make the rules.
yeah. I get it, and that's a whole area of interesting debate and controversy, because there's so much that goes into that. And speaking of hormones, a lot of people feel like eating after dinner can mess with melatonin, so we don't raise the melatonin like we should, because we get our digestive system going. So that there's a variety of back and forth on the
Let, let me.
eating, late night snacking, and eating in the middle of the night.
You asked me how I could make these kind of claims when nobody else is making these kind of claims. And let me tell you about a patient that came in to see me. He was 47 years old at the time. And the reason he came in to see me is because every morning he would wake up and vomit. Now,
Hmm.
the only thing that'll cause that kind of vomiting is excess adrenaline. And he also had severe fibromyalgia.
Hmm.
Um, and so what I did, I put some progesterone cream on his forearm, and he rubbed the two arms together, and we started talking again. And about 5 minutes after I put on the cream, he sat back in the chair he was sitting in, and he looked at me and he said, "Doc, in my entire life, I have never felt this good." That's after 5 minutes. So do I think it works? I know it works.
Okay,
Uh,
so
he,
tell us
he
about progesterone cream. What is progesterone?
Well, progesterone is a hormone. Most people, including doctors, think it's a female hormone, but men and women have the identical hormones, different levels, but the same hormones.
Okay.
Men stop making progesterone right around the age of 50. It's gone. And what's interesting is that after the age of 50 is when men start developing prostate cancer. They start putting on weight around the middle because they no longer have a hormone that blocks estrogen or insulin like progesterone does. So it's an important hormone for men, even though nobody ever talks about it for men. Um,
Hmm.
the so, but it's mostly known as an anti-estrogen hormone, and for women, and it is. It gets rid of cramps and PMS, and if women use progesterone cream, there'd be no fibroids, there'd be no endometriosis. Um, Unfortunately, women go to gynecologists, and I have to be honest with you, gynecologists do not have a lot of training in hormones. Um,
Hmm.
there are exceptions, but the rule is that they don't know hormones. They're the ones that put women on birth control pills for everything, even. But the problem is when women take birth control pills, they stop ovulating, which means they stop producing progesterone. And that's when they start developing all the side effects of estrogen, the polycystic ovaries and the fibroids, endometriosis, and, estrogen causes 6 different cancers in women. It's a toxic hormone.
Well,
And
and let me just interject there too and add one little caveat to that. The amount of men on testosterone replacement therapy in the United States is skyrocketing, right? And I've had
yes,
2 testosterone replacement therapists on my show. And when men start on a testosterone replacement therapy, when the testosterone rises very high, the estrogen rises very high too. So then they're on estrogen blockers. And so we now have probably millions. I don't know the number of men on testosterone therapy in this country, but every single one of them or most are or should be also on an estrogen blocker. Now, in that case, would progesterone be a better and more natural solution for them too?
well, and any male that's on testosterone absolutely should be on progesterone. Um, Only because it prevents the cancers that estrogen causes. And you're right, they should be on some type of estrogen blocker. Um, and but the problem is that doctors go to a weekend seminar, they learn about putting in pellets and all this kind of stuff, and but these pellets are put in, and people don't realize the downside to too much testosterone. You can't just look at a blood level and say you need testosterone. You can never go wrong treating a patient, but you can go wrong treating a blood level. And and
Interesting.
frankly, men that need testosterone are the ones that no longer have what are called morning erections. If men are getting morning erections, they don't need testosterone. They have plenty of testosterone. I just want to let your people know that. Um, the but testosterone can also increase the blood count. And it thickens the blood, predisposes to heart attacks and strokes.
Hmm.
So testosterone is an incredibly important hormone to men if they need it. If they need it,
Yeah.
but
Yeah.
and that's the key word. I always prefer creams to injections or pills or whatever. And the reason for that is that you have complete control. You can titrate the dosage with a cream. You can't do that with injections or pellets or whatever. Um, but that's me. That's
Okay.
my.
But
Um,
you have, through all this research and all this clinical experience that you have had over decades now, you have found that progesterone cream is a fantastic solution for both men and women. Is it for everybody? I mean,
well,
or who
you,
should be using it?
the well, first of all, it could be for everybody. However, there is one downside. Uh, one of the benefits of progesterone is that it causes some degree of what's called insulin resistance. Now, what this means is it um, makes it harder for insulin to get sugar into cells. Now, this is usually a benefit. It prevents people from getting sleepy in the afternoon. It especially is important. It prevents people from getting sleepy when they're driving. I used to have to slap my face when I was driving, trying to keep my eyes open. But going back 20, maybe 30 years using progesterone, since I started using progesterone, I have never ever gotten sleepy in a car. But that's
Interesting.
neither here nor there. But the point that I wanted to make is that um, it does create some degree of what's called insulin resistance. Now, you're familiar with type 1 diabetes and type 2 diabetes. Are you familiar with type 3 diabetes?
I have never even heard of it. Only 1 and 2.
Okay, well, there is a type 3 diabetes, and
Okay.
the other term for it is insulin resistance in the brain. Now,
It's
you may have
not pre-diabetes.
no,
Okay.
you may have heard the fact that coconut oil can be very beneficial for people with Alzheimer's. Have you heard that? Never
I
heard?
haven't specifically. I've heard that it's it's good for all kinds of things, and I use it. I keep it in my pantry. It's a staple in our house, but I didn't
Okay.
know specifically.
Well, yeah, the reason why it's important to know about type 3 diabetes, it's probably the number one precursor to Alzheimer's.
Hmm.
Um, and and what happens is that the insulin in the brain can't get glucose into the brain cells, but but a really important fuel for the brain are ketones. And so that's where MCT oil or coconut oil comes in, and it has been curative for a lot of people with Alzheimer's, because once they get
Wow.
that, they wake up. Okay. So the thing about type 3 diabetes, there's no test for it. However, people that have type 3 diabetes, when they put progesterone cream on their skin, within minutes they get an outpouring of adrenaline. And the reason for that is that the progesterone increases the insulin resistance in the brain to the point that the body has even a harder time trying to get glucose into the brain cells, and pours out adrenaline to raise glucose levels. So, um, so I, so if you have somebody who is using progesterone cream and just gets an outpouring of adrenaline, that's type 3 diabetes, which means,
Interesting.
and the way to treat that is again with coconut oil and MCT oil, but doctors don't realize that. Um, and again, they don't know there's a test for it, which is progesterone. Um,
Is coconut oil part of your daily diet?
Absolutely.
How
Um,
much? How much, and what's your favorite way of taking it?
well, coconut oil I recommend as a cooking oil because it has a very high heat threshold.
Yeah.
The MCT oil has no flavor, so it's good to add to food. As you may have heard of bulletproof coffee. People put
Hmm.
uh, okay, but and I recommend as a side dish sweet potatoes that have been sliced up and fried in coconut oil, and this way they get the glucose from the sweet potatoes and they get the ketones from the coconut oil. So it's a good side dish. It's something they can eat at dinner and eat some before going to sleep. Um, yeah, it, if anybody needs it, on my website I have a 30-day meal plan to lower adrenaline. Um, but
Well, absolutely. What's your website?
It's plattwellness.com, Platt, plattwellness.com.
Okay, and they can
Um,
find your progesterone cream. Is it affordable? Can we afford the cream?
you can, and and your listeners get a 10% discount. I,
Ooh,
I'm you know, um, I'm, yeah, um, it's the name of your show plus 10. They get a 10%.
Dirobi. Sorry, it's not a very memorable name. Dirobi 10. So
Yeah,
that's the coupon code.
yeah,
Okay.
and usually, but almost every weekend we have sales going on. Now they can only use one sale at a time,
Yeah.
but
Yeah.
but but we try to make it as affordable as possible. Um, the and I've eliminated everything in the cream that can cause a rash or side effects, whatever. It's all natural, bioidentical progesterone. And while I'm talking about it, the people should really be aware that most progesterone today that's prescribed is prescribed as an oral type capsule, and or troche that they put in the mouth. People have to be very aware that oral progesterone converts into a different hormone called allopregnanolone, which is not progesterone. Um, and so they're not getting any benefits from it.
We have
So
this
that
exact same issue with our glutathione product. Glutathione is 3 peptides, and when swallowed, the stomach breaks it down into the 3 peptides, and the glutathione doesn't go into the system. And so we specifically sell it as a spray so that people put it in their mouth and it goes into the
goes into the
bloodstream. And
mucus. Yeah.
these are interesting little
Yeah.
scientific things a lot of people do not understand. That it really does matter that you take some of these supplements the right way. In your case, the cream is far superior to ingesting.
Um, the people with restless leg syndrome, they just have to put some progesterone cream on the top of the thighs and massage it in. People that get cramps in their calves or feet, that's also adrenaline. They just have to massage it where the cramp is. It'll go away in about a minute or two. Um,
Wow.
the Yeah, and um, s- the the best place to put progesterone is on the forearm, but people with a lot of tension in the back of the neck or have ringing in the ears, the back of the neck is a really good place to put progesterone cream. And the
And what's the size? So this is a cream. So are we squirting out like the size of
it's
a
a it's a
dime?
it's a pump. Well,
It's a pump, so it
yeah,
gives us
one
okay.
pump is a quarter of a teaspoon, and that's
Okay.
50 milligrams of progesterone.
Okay. And you do that
Was
once a day.
Well, in the beginning, actually 4 times a day,
Okay.
until the adrenaline goes down. And adrenaline, it doesn't take long for the adrenaline to go down. People with road rage, they can eliminate road rage in about 24 hours, just by lowering adrenaline. Um, but ADHD, you can get rid of in 24 hours just by lowering adrenaline.
That's
But
crazy.
you know, this PTSD and bipolar disorders, also caused by adrenaline. And I mentioned weight gain, very common, um, related to adrenaline. Um, so um, anyway,
This is the part of the show where I have to say this show is for educational purposes only. We're
yeah.
not making
Oh, right.
claims. We don't want to get in trouble or get the FDA after us. But this is your real world experience that you're just sharing, and you are a doctor and you have been doing this for a very long time. And so I present the information as information and education, not as diagnosis or making promises
Dave, let me
here.
tell you something. One of the things that perhaps gives me the most credibility
Yeah.
is that the medical board in California has gone after me more aggressively than any other doctor ever in California, even though I've never harmed a patient, they've never had a complaint from a patient, but they have gone after me aggressively, um, trying to, I spent $500,000 trying to fight them 10 years ago and they gave up. You can't beat them. And they've arrested me 4 times,
You're kidding.
for no reason at all. The last time they arrested me, one of their undercover agents came into my office, and he was on a statin drug, Lipitor, and he had developed diabetes. And I told him that there's a 50% incidence of diabetes from statin drugs. So he said the fact that I told him that I was practicing medicine without a license, and they arrested me. I have to go to trial on
Mm.
that. I, you know, um, the medical boards are completely funded by drug companies, and I'm very anti-drug, and they know that. Um, in fact, they originally went after me because doctors complained about me in my town because their patient came in to see me. I took them off all their medications, and I do that because, like I say, when you treat the cause of illness, people don't need drugs. They get better. But that really opened the eyes of the medical board because they're funded. They're there to protect the drug companies. And
Yeah, and just to be clear, the statements I was making is not to cast doubt on you or your credibility. It is this very thing you're talking about, that there's that as much as we talk about free speech and just want to discuss health issues, right? It is a shame that we have to protect ourselves so much. We can't just talk without wondering who's listening and what their MO is and who funds them. And the fact is, it has gotten out of hand that we have the big brother of health is very strong in this country. And it's actually a shame because it's hurting all the natural practitioners, all the small people who can't afford to do massive studies on their products and on their stuff. And then at the same time, these people hide behind their big studies, many of which they don't publish because it makes them look bad. So they have the money to do it, but they can also get around the system by picking and choosing what they make public. And so I just want to throw that out there that I'm much more on your team as far as wanting people to experiment, wanting to have doctors like yourself uh, find these things, publish these things, and then find a listening ear. And unfortunately, it's too much all run by, there's big, big out of control bureaucracies lots of money. There's probably a whole lot of people that don't want to solve big problems with something inexpensive like a cream. So right out of the gate, they're not
Mhm.
interested in doing the research because
Oh,
they don't make money on it.
well, they can't patent natural products.
Right.
And
Therein lies a huge problem in the whole system, right?
it is it's yeah, it is a
Well,
problem.
listen, Dr. Platt, it's been fantastic to talk to you. It's been a fun conversation. You've given us some great information. But before I let you go, any closing thoughts that you want to share with us?
Um, Well, just that people have to learn to be proactive when it comes to their own health. They can't rely on a medical system that's controlled by an entity that has no interest in their being healthy. Um, they have to question, and unfortunately, doctors very often do not have the answers that they're going to be looking for. The FDA just approved a drug for Alzheimer's. Um, their own committee turned it down, and yet they still approved it. $85,000 a year for a drug that does nothing, and so everybody pays for that because people on Medicare, the, you know, they pay more money now for Medicare. I'm just saying, it's just people
We
are
we
affected whether they know it or not. Yeah, go ahead.
Yeah, it's a system really built on soft corruption. It really is. And I definitely agree with what you said. Unfortunately, the system does not actually seem to care about the individual's health or health. They think they do, but it's fake.
Yeah, but I'm always available to answer questions if people have questions. Um, and medicine has always been a passion for me. But I think the thing that influenced me the most in terms of what I wound up doing was my mother, who died of breast cancer at the age of 61.
Hmm.
And it was right after she died that I realized that I had inherited her hormones. Men and women have the same hormones, and that's how I got interested in hormones. And
Hmm.
so she's probably had the most influence in terms of the direction that I took. Uh,
Nice.
and unfortunately, the treatment of breast cancer has not changed a whole lot since. And this she was back in 1980 that she died, and things are just about the same. You know, don't get me started
Isn't
on
that interesting?
on.
Yeah, yeah.
Oh,
No, I get it. I get it. Super
yeah.
frustrating. We've put billions of dollars literally into cancer research and haven't done hardly anything.
They won't
And
let they won't allow it.
yeah, unbelievable. Well, Dr. Platt, it's been a pleasure to have you on the show. It's been fun. You've
Hope it
provided
hasn't
all
been too
kinds of
depressing. Yeah.
no, not at all. And I think you've
Oh,
been very educational, really helped us understand better the relationships between adrenaline and some of these conditions, potential improvement that people could have. And then, of course, tell us your website one more time.
it's www.plattwellness.com.
Okay. And
PLATT plattwellness.com. Yeah,
thank you. And for those of you listening, if you use the code DIROBI10, you'll get 10% off anything that your little heart desires at
exactly.
that website. Okay,
Yeah,
Dr. Platt, thanks again for coming on the show. It's been great.
I enjoyed it. Thank you.
Okay, and for those of you listening, this is Dave Sherwin wishing you health and success.